Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's podcast, I featured Dr. Monica Williams-Murphy from OKToDie.com in an interview. You can check out last week's podcast and interview if you're clicking on the link below this video. In this week's blog, I want to share with you how to mute your negative inner dialogue whilst your loved one is critically ill in intensive care. It's very easy to get bogged down and become negative if your loved one is critically ill in intensive care. After all, you and your family are facing one of the biggest challenges in your entire lifetime. Having a loved one critically ill in intensive care is nothing short of being a once-in-a-lifetime experience and a once-in-a-lifetime challenge. Research suggests that the change in the health status of a family member is in the top 10 of the most stressful events in one's lifetime. Imagine that. The change in the health status of a family member is in the top 10 of the most stressful events in one's lifetime. It doesn't mention critical illness, it doesn't mention intensive care, and it doesn't mention situations where your critically ill loved one is very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or is threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or is in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one, or your critically ill loved one might even be approaching their end of life in intensive care. But remember, all the quote says is that the change in the health status of a family member is in the top 10 of the most stressful events in one's lifetime. I bet that your and your family's stress levels are through the roof. And I can tell you, after more than 15 years intensive care nursing in 3 different countries, and after I have literally worked with thousands of critically ill patients and their families, I know firsthand that the stress, the frustration, the anxiety, the overwhelm, and the level of vulnerability you are currently exposed to have skyrocketed. And during this difficult, challenging, and once-in-a-lifetime situation, when your loved one is critically ill in intensive care, it's very easy to become negative. It's easy to become negative, especially if you look around and see all the other families of critically ill patients in intensive care who have no peace of mind, no power, no control, and no influence. It's palpable that those families of critically ill patients in intensive care are negative. You can see it by their poor body language, and you can hear it in their tone of voice that the intensive care team controls them. Those 99% of families of critically ill patients in intensive care who have no peace of mind, no power, no control, and no influence are held hostage by the intensive care team's positioning, and they are held hostage by the intensive care team painting a quote-unquote doom and gloom and a negative picture. They are also held hostage by their own negative and pessimistic inner dialogue and their inability to take action and start becoming proactive. And I'm not talking about those situations where your loved one is in intensive care for a couple of days. I'm talking about those situations where your critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation or is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or your loved one might be threatened with an NFR or a DNR order, or is in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one, or your loved one may even be approaching their end of life in intensive care. And because if your loved one is critically ill in intensive care and is facing one of the aforementioned massive challenges and difficulties, the intensive care team will put it in a negative light so that they can not only protect their professional reputation in case things go wrong. They will also put things in a negative light because of their competing interests, the dynamics, the psychology, the intrigue, the power play, and the hidden agenda behind the scenes in intensive care. It makes the intensive care team always position your critically ill loved one's diagnosis and prognosis in a way that keeps all their options open. Keeping their options open means that at any given point during your critically ill loved one's stay in intensive care, the intensive care team wants to be in a position to stop or limit treatment if they think that it's taking up too much of their financial or emotional resources to continue treating your critically ill loved one. The intensive care team is also very shrewd and adept to quote-unquote sell you and your family on the idea that withdrawing or limiting treatment is in quote-unquote the best interest of your critically ill loved one. The intensive care team is also doing it to manage their beds and patient flow effectively. For example, intensive care beds are very scarce, expensive and in high demand, and if at any given point during your critically ill loved one's stay in intensive care the pressure on beds gets too high, again, the intensive care team wants to be in a position to admit other patients that they may deem more financially viable, more interesting and more quote-unquote sexy to look after. The intensive care team also wants to conduct medical research on their critically ill patients. After all, medical research is a multi-billion-dollar per year industry, and often care, treatment and the positioning of your critically ill loved one's diagnosis and prognosis is dependent on whether the intensive care team can enroll your critically ill loved one in a medical research study. This is only a snapshot of the moving parts in intensive care behind the scenes. This is only a snapshot of what you and your family have to consider if your loved one is critically ill in intensive care. And it's only a snapshot of why you and your family have the negative talk in your head that things are pretty dicey. The alternative is to stay positive anyway, no matter the challenges you and your family are currently facing. The alternative is also to be proactive. The alternative is to start managing the situation from your end. And the alternative is to simply have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care. The alternative is also to start doing your own research, to not take anything for face value the intensive care team is telling you. The alternative is to have a plan and a strategy to turn things around in your favor, no matter how difficult the situation is. Here are some related articles that you can read or watch. One of the articles is how to turn things around in your favor if your loved one is critically ill in intensive care, and the other one is how to overcome insurmountable obstacles if your loved one is critically ill in intensive care. Check out those two articles and videos by clicking on the links below this video. The other alternative is to also not take no for an answer, no matter how challenging the situation is. And the alternative is to get a handle on things and to get an unfair advantage compared to 99% of families of critically ill patients in intensive care who remain at the mercy of the intensive care team and who are left behind without peace of mind, without power, without control and without influence. By now you know that peace of mind, control, power and influence are within your reach. You know it's possible, and you know that if you keep arming yourself with the right tools and the right strategies, I promise you the intensive care team will notice and they will treat you and your family differently compared to the 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence. You know by now that if you keep going against the grain, the intensive care team can't keep playing their games with you, and they will literally have a hard time to keep playing their games with you and keep you at arm's length, so to speak. Every family that I have counseled and supported so far has always confirmed that my strategies work and that all of a sudden they have gotten results and the intensive care team changed their positioning. All of a sudden those families had negotiation and bargaining power. Because if you keep asking the right questions, if you are not intimidated by the intensive care team's perceived power and perceived authority, you will find yourself in a position where you will have peace of mind, control, power and influence, and muting your negative dialogue is almost a direct result of having peace of mind, control, power and influence. So how can you quickly get peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill or is even dying in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where I answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.